Okay, I'm Dr. Ezi and I'm continuing in the polytrauma station. This is session 10 in this station. And now the examiner will jump to something completely different. The examiner will ask you now about bone healing, and he will ask you what are the stages of bone healing. This is not related to anything, okay? But you want to answer this question because, as I told you, they will test you in many topics in the same station because you have 2 to 3 stations, so you have to answer all the questions. So there are 4 stages of bone healing, and this is the ideal answer that you want to tell to the examiner. There are 4 stages. The first stage is called hematoma formation, okay? Hematoma formation is the stage 1, and the second stage is something called the callus, or the fibrocartilaginous callus formation, okay. The third stage is the bony callus formation, okay. And the fourth stage and the final stage is called the remodeling, okay, remodeling, okay. So these are the 4 stages of bone healing. Unfortunately, you want to tell the details of every stage, okay, and these details are not that much, so they are so easy. If you start with the hematoma formation, stage 1, hematoma formation. Hematoma formation means, from the name, that it means that there is a blood that is clotted at the site of the fracture, okay. So there is a mass of clotted blood at the site of the fracture, and this is the first thing, okay. There is a clot there. And the second point that you want to remember here is that there are signs of inflammation. There is severe pain, there is swelling, the bone cells are definitely dying, so you have signs of inflammation. So hematoma is characterized by a clot of blood or clotted blood at the site, at the fracture site, okay, and this inflammation, swelling, severe pain, and so on. So this is about hematoma. It's so easy, okay. So now we will go to the second one, which is fibrocartilaginous callus formation, okay. Fibrocartilaginous callus formation, okay. And here actually you want to remember some points. First of all, you want to know that this stage starts from the fracture time and it continues up to 3 to 4 weeks, okay. This is the first important information. What happens in this stage? There is capillary growth in the hematoma. We told that there is a clot or hematoma that is formed in the hematoma formation stage, the first stage. So now there is something called capillary growth, and this capillary growth is through the hematoma itself, or the clot itself, okay. This is number 1. Number 2, there are some phagocytic cells that are invading there, and they are cleaning up the debris at the injury site, okay. So the phagocytic cells are cleaning, okay. Well, there is another thing, additional thing that happens here, and it is the migration of fibroblasts and osteoblasts at the site to begin to reconstruct the bone, okay. So there is migration. So I will change the color back again, okay. Well, so there is migration of the remember the names of these cells. These are fibroblasts and osteoblasts. Both of them are osteoblasts. Both of them are blasts, okay. So these are the things that happen in the fibrocartilaginous callus formation stage, the second stage of bone healing. Number 1, it starts from the time of fracture and it continues for 3 to 4 weeks. Number 2, there is capillary growth through the hematoma itself, okay. and phagocytic cells start cleaning the area and cleaning up the debris of that happened due to inflammation and the battle of the first problem, the fracture itself. And finally, there is migration of fibroblasts and osteoblasts to the site to make reconstruction. The most important thing that you want to know that this callus, fibrocartilaginous callus, acts as a splint. This is a natural splint that splints the fracture while it is until it gets management and the artificial splints that is made by the orthopedician. Okay, so this is the second stage. We will go now to the third stage, and the third stage, as we told before, it is the bony callus. And what are the most important information that you want to remember in this stage? Number one, it starts from 3 to 4 weeks. As we told that the previous stage, the fibrocartilaginous stage, takes from the beginning of fracture at the time of fracture to 3 to 4 weeks. So this extends for 3 to 4 weeks from the time of the fracture up to 2 to 3 months. Okay, so this is the period in which the bony callus is formed. Okay, so there is continuous migration. This is the second thing, continuous migration of osteoblasts, okay, as it was there in the previous one, but now there are also osteoclasts. And what is the difference between osteoblast and osteoclast? I don't know if you know or not. So let me tell you. Osteoblasts actually builds, they produce bone cells, and osteoclasts actually absorb or destruct bone cells. So bony callus here is formed, and there are osteoblasts that produce bone cells, and osteoclasts are now working as starting the process of remodeling already. But this is not a remodeling stage, this is a bony callus stage. The most important cells in this stage are osteoblasts and osteoclasts. The most important cells in the second stage, the fibrocartilaginous callus, what are the most important cells there? Osteoblasts and fibroblasts. Okay, here osteoblasts and osteoclasts. I think that is clear. Okay, so in this time here, continuous migration of these cells to the site. Okay, and now the fibrocartilaginous callus now is turned to a bony callus. Okay, so all this process is to transform the fibrocartilaginous callus to a bony callus. Okay, well, so now we will go to the last stage, and the last stage is remodeling. It is the fourth step here. And remodeling, okay, remodeling, what do you want to remember? First of all, everything is done here. There is a bone already, but you want to remove the excess materials. Okay, so removal of excess, you are cleaning already of excess materials after building. You constructed a building, there is a lot of rubbish there, and so remodeling is removal of this excess of things. Okay, and now the second thing that happens and results of that is that the compact bone is called compact, and the compact bone, so the bone which is surrounding the bone marrow and these details, the compact bone is now laid down. And they like this word, laid down. I don't know why, but they like you to tell that the compact bone is laid down. You will feel that you are professional. Okay, so now the reconstruction will continue. The remodeling will continue for a very long time. Actually, it takes a very long time, but this is the last stage of bone healing.